endocrinologist at University of Michigan, and I actually have an alternative online identity as doctor's designer, and I am very passionate about patient-centered participatory design and making in health. And I fell into design through a personal health experiment. So I'm the caregiver for 2 kids with food allergies, but me in particular. We came out to the Valley for sabbatical 2 years ago, and he has food allergies, and we have to teach people how to give this EpiPen. We have to use that. We have to use that meaningful use paper that's actually not that useful, right? So we decided to make a YouTube video, and when I say we, it's the collective we, because I'm a lazy tiger mother, and I had to make this an educational experience for him. So I'm not going to play the video for you. It's at ihavefoodallergies.tumblr.com. He has his own blog, but we basically did this as a collaboration. I did the scripting, he did the illustrations, and the narration. And it's a pretty compelling video, although I'm not biased, right? So it got a lot of play in the blogosphere, and it has like 1,700 hits now, but I actually call it a design success because it's the tool that we use every time we go to a new doctor or a new school giver. It's the tool that we use to just kind of carry on in life, right? And so we've been doing a ton of other making projects like ingredients and asthma and developing low fidelity versions of name tags for the caregivers, as well as even making cardboard allergic reactions as demos. So what this taught me is that this is really the future of healthcare: patient as expert, patient as maker, and patient as collaborator. And I came to that sort of conclusion by myself, but when I got back from sabbatical, I really wanted to dive into participatory design making and integrate that into healthcare and the world that I live in. So we have this collaborative called Health Design by Us, which is a group of patients, caregivers, healthcare providers, individuals from School of Information, School of Art and Design, and we've been doing a ton of different ways of prototyping and tapping into the wisdom of patients in healthcare. So we're doing design workshops, we're doing maker workshops, we're pairing patients with designers to really bring the wisdom and expertise out of our patients. So we actually just did a design workshop last weekend with JDRF, and we had 100 kids, 4 facilitators, 1 hour to go through the entire design process, and I was a little daunted, but it actually was an incredible experience, and they had fantastic ideas. And this is just one of the ideas. I mean, this is mobile technology for health, right? And it's not something that a VC might fund, right? But it's incredibly important emotional design that a child needs to navigate diabetes with her mother. We're also doing participatory game design with a company called GameStart. It's a local startup in Ann Arbor, and we're trying to get kids to be the creators of games for diabetes, learn the mechanics of diabetes, and share that in a peer-to-peer learning environment. And then we're also doing make health events. We had the first one last year. We're actually going to have another one in October this fall, but to bring together the patients, the caregivers, the healthcare providers, and all the makers and tinkerers to figure out what we can build as a community. And then finally, one of the things that we're really thinking about is this concept of design and making, not as a distraction from health, right? But really as being a critical tool for the creation of health. And you may ask, why do we need makers in health? And this is a living example of why. So this is something that has really rippled through the type 1 diabetes community that I'm a part of. It's the Night Scouts project, where a dad hacked into a CGM and got the numbers to go to the cloud because he didn't have access to them. He ended up tweeting it, and he ended up sharing it with a larger group of individuals who were also dads of and caregivers of patients with type 1, and they ended up developing a whole bunch of tools, a Pebble application, mobile applications, desktop displays, care portals, right? And I call them the diabetes homebrew club, right? But they opened up this Facebook group. It's called CGM in the Cloud. It has over 12,000 members now, and there are people on this group that are sharing solutions, that are sharing the rig, they're making their own artificial pancreases, they're making all sorts of really interesting technologies. And the most amazing thing is what they're doing is they're actually impacting regulation of health at the level of the FDA, and they've really brought a community together that's done this out of love and out of this mission for paying it forward to your fellow community member. So I want to transform what is this clinical experience on the left, right, to be a maker experience, because I know that is what's going to be the future transformation of healthcare. And I want you guys to help me figure out, or help us figure out as a collaborative, how do we make making as the present of healthcare as opposed to the future. So, thanks.